My name's Mike Behringer, registered nurse, 40 years of frontline healthcare experience, running niches, the whole works. So, what I'm going to share with you right now in the next few minutes is how to handle that closed off patient, that person who's just guarded, they won't relax, and it just doesn't feel like they want to be there. So, what do we do when that person, after you introduce yourself, they're just closed off? Do we just continue with our process? Or do we address the fact, that's the elephant in the room? So this is my recommendation. Ask them. Seems like you don't want to be here, right? And the patient may come back and say, well, my doctor told me I shouldn't even come see somebody like you. But provide them with empathy. Say, listen, I completely get it. As I mentioned, I've treated so many patients successfully, and in fact, I'm part of a network of providers across this country who've treated hundreds of thousands of people successfully. Now, I know, you don't believe that, but may I ask you a couple questions, right? Can we agree that the reason you and millions of other neuropathy patients feel symptoms is at the root cause of that is because the little blood vessels around the nerve cells and surrounding tissue, they're kind of shrinking and shriveling up, and the cells can't breathe, right? Well, yes, right? We got to get that across first, right? That this is what it is, because it's just a math problem. We know how to do this. So we get them to say yes, and then ask them, can we also agree that our bodies make new blood vessels every single day? We get a cut and that blood supply comes back. It doesn't just end. Hearts make collateral circulation. Can we agree that the body knows how to make new blood vessels? Well, sure. Have any of the specialists you've gone to, have they ever mentioned a term called angiogenesis? Well, no, probably is the answer. And if they say yes, I would qualify that answer, because the true answer is probably no. We want to just share with them that this is just a big fancy word for the process our body goes through to make new blood vessels. It's angiogenesis. And the way we do that normally is, we're doing it right now, is we eat and drink things that give our body the ingredients for a substance called nitric oxide, right? And nitric oxide is the initiator of angiogenesis, or new blood vessels forming. And that nitric oxide, those ingredients are stored in the cells, and they're only released when we're exposed to certain rays of light from the sun. So when we go out in our normal day, the wavelengths of light penetrate our cells and release it, and blood vessels form, right? Sun makes vitamin D. We understand this, right? So we just got to tell them that, listen, I understand there's confusion, but what we do and what's used across the country is we provide the body with the amino acids and trace elements in abundance for nitric oxide production. And now your cells are just ready to let that go and form new blood vessels. But even if you could stand naked in the sun for 24 hours a day, it still wouldn't be enough, right? Because when you have neuropathy, right, the deterioration is so much quicker than your body's ability to form new blood vessels. It's like, bailing out a sinking boat with a bucket that has no bottom in it. You're not going to get anywhere, right? So what we use is a technology in our Anodyne device that was discovered initially by NASA for wound healing in space. And what it does is it replicates the rays of light from the sun that release that nitric oxide and start those blood vessels to start forming. And it is exponentially quick. And you should know that after we're done here today, if you're fortunate enough to have me offer you a position in my program, what that means is I expect you to get great results. And understanding, obviously, that there's a lot of confusion and even skepticism around the treatment of neuropathy, let me kind of break down what great results are. For the hundreds of thousands of people across this country who suffer just like you, over 85% of them have noticeable and lasting improvements in as early as 3 weeks, and the remainder inside of 5 or 6 weeks. You've been suffering for how long? 10 years? Wow. I'm sure that's impacted your life. What would it mean to you and your family if you could start feeling noticeable and lasting results in early as 3 weeks? It would mean everything. So again, that's my recommendation for dealing with the knowledge people. This same approach can be used on ad comments, telephones, and if you'd like to learn more, please get in touch with me. There's probably some information here, and let's get on a call. All right? Take care. Keep changing lives. Bye bye.